Thanks for the question, Chris. I'm glad you asked. Should a therapist, a massage therapist, somebody in the manual therapy world, have a timeline of when they expect to end with a client, or should they be constantly trying to keep them? What's the good business ideas around that, slash kind of the ethical question of it as well? I really think that when you are desperately trying to cling to somebody who obviously doesn't need to, or maybe even doesn't want to see you anymore, it comes across as like untrustworthy, and then people feel like you're sort of leading them on, and that actually drives people away. People don't want to come see you if they don't trust you and think that you have their best interest in mind. So I really feel like when you think somebody doesn't need you anymore, you've got to have the conversation of, hey, I think that we've fixed all the problems, we've hit all the goals that you've had, and we have like a mission accomplished right here. And you celebrate that, and you follow it up with, at this point, I don't think you have to come in and see me. So you could either choose to come back and keep seeing me, or at this point, you could move along and we could part ways, and you could just come back in the future if you ever need to see me again. I think having that conversation and establishing that like you're good in a good place now, it celebrates the fact that you got them results, and it shows that they can trust you. You're not going to try to string them along. And I think that if you are a really good therapist at what you do, you're not usually desperate for lots of people, because if you're doing good work with folks and that happy person that we just talked about left and they, got great results with you, they're going to go tell their friends, and now they've got friends coming and seeing you. Like, I'm not usually in a desperate need to go look for new people. Usually people come to me, and as soon as I send one person out the door, hey, you're all better, go live a happy life, there's another person knocking on the door trying to come on in. And I think also when it comes to the techniques that you're doing it, and what kind of therapy you're doing with people, it can also depend a little bit on who you're seeing. Like, sometimes I've seen people with chronic conditions where they're not getting better, they just always need care for that. Or somebody who works a really tough job that really wears out their body, and they just kind of always need some attention. And I think in those circumstances, that's fine. I just think that you have to present in a way where you're being super, super honest and in the best interest of the person. I think that's what people respect and trust and are willing to pay money for. Now, I want to shift gears here with a question for you, Chris. Um, I'm curious, what do you think are some of the training avenues or exercise themes you could go down as a trainer that you think have the best ROI, return on investment? Like, should a trainer really focus on corrective, sports performance, geriatrics? What's the style of training that you think is the best investment in your training?